LaHood. The chair recognizes the gentleman for 2 minutes.
Thank you, Mr. Speaker. I rise in support of this measure. As a former state and federal prosecutor who's been in charge of prosecuting narcotics cases, I've seen firsthand the devastating effect that opioid and heroin addiction has had. This nationwide opioid and heroin epidemic stretches home into my district in central and west central Illinois. 78 people die from heroin or opioid overdoses each day. That's quadrupled since 1999. Now it is the leading cause of death, far surpassing deaths by motor vehicle accidents. Just last week, I hosted a series of roundtable forums across my district to personally hear from law enforcement officers, medical professionals, treatment providers, local government officials, and those who have lost loved ones due to overdose. They shared with me the reality of the situation back home. Law enforcement has had to double its hand-on stock of Narcan and expanding training for police officers when it comes to these overdoses. Heroin is now the primary abused substance in drug court programs like the one in Springfield, Illinois. But those programs are at capacity. Treatment centers have wait lists over 40 days. The consensus was clear. This is a public health crisis. To end it, we need it. We need to do a number of things. Update medical best practices for coping with pain. We need to expand access to addiction specialists and treatment centers. We need to give law enforcement the tools they need, and we must continue to promote programs like drug courts. Because this problem is complex, it must be addressed from all angles, and that is precisely what we are doing in the House this week. This bill will address this epidemic and the concerns I heard last week. It would establish a comprehensive opioid abuse reduction program at the Department of Justice, target federal resources directly at the opioid problem, and give states flexibility, and create a streamlined, comprehensive opioid abuse grant program. Without raising taxes, this measure authorizes $103 million each year for a variety of programs, including residential substance abuse, drug courts, training for law enforcement and first responders.
Chairman, it's my pleasure to yield an additional minute.
The chair recognizes the gentleman for an additional minute.
Thank you, Mr. Chairman. This funding includes treatment for law enforcement and first responders and criminal investigations for unlawful distribution of these opioids. Opioid addiction transcends socioeconomic boundaries, racial, gender, regional, and educational boundaries. We need to address this crisis now. I thank my colleague, Mr. Sensenbrenner, and Chairman Goodlatte for bringing this legislation forth. This is a problem that is preventable, and we are doing something about it this week in the Congress. I'm proud to support this legislation. I look forward to supporting it. I yield back.
The gentleman yields. The chair recognizes the gentleman.